Chapter 3, Counseling 6303, Human Sexuality, for Houston Baptist University, recorded by Dr. John Spody. Female Sexual Anatomy and Physiology. The vulva. This is the external female genitalia. The mons veneris is a triangular mound over the pubic bone above the vulva. The labia majora are the outer lips of the vulva. The labius minora are the inner lips of the vulva. The clitoris is a highly sensitive structure, only function of which is sexual pleasure. The vestibule is the area of the vulva inside the labia minora. And the urethra is the tube opening through which urine passes from the bladder. The vulva continued. External female genitalia. The introitus is the opening of the vagina. The hymen is the tissue that partially covers the vaginal opening. The perineum is the area between the vagina and the anus of the female, and the scrotum and the anus of the male. Genital alterations. These include piercings, jewelry, cosmetic surgery, and other. Below you'll see a diagram of female genitalia. Underlying structures. Several structures under the hair, skin, and fatty pads of the vulva. Cavernous bodies and vestibular bulbs, engorged with blood during arousal. Bartholin's glands secrete a few drops of fluid during sexual arousal. Pelvic floor muscles and Kegel exercises. Kegel exercises can be used to increase the strength of pelvic floor muscles. Below is a diagram of the underlying structures. Internal structures. Internal female sexual anatomy. Vagina is the stretchable canal in the female that opens at the vulva. One of the sexual pleasure centers for the vagina is the Grafenberg or G-spot. During arousal, the vagina can produce lubrication. However, at times, lubrication will have to be added during sexual intercourse. Vaginal secretions are designed to maintain the chemical balance within the vagina. Cervix, the small end of the uterus located at the back of the vagina. Uterus, the pear-shaped organ inside the female pelvis within which the fetus develops. Internal female sexual anatomy continued. Fallopian tubes are two tubes extended from the sides of the uterus in which the egg and the sperm travel. Ovaries are female gonads that produce ova and sex hormones. Figure 3.4 shows internal female sexual anatomy and is a cross-sectional side view of female internal structures. Figure 3.4, this is a diagram of internal female sexual anatomy from a frontal view of the internal organs. Parts of the ovaries, uterus, and vagina are shown cut away. Menstruation. Menstruation is the sloughing off of uterine lining, and this occurs or takes place when conception has not occurred. There are various attitudes about menstruation. As discussed in Chapter 1, there are many historical views and perspectives that are negative beliefs about menstruation. Menarche is the initial onset of menstrual periods. This generally occurs between the ages of 11 and 15. There are several factors that influence the onset of menstruation. Some of these factors include heredity, health, and altitude. Menstrual physiology. Flow. During menstruation, the flow of blood can last between 2 and 6 days. Volume. The volume of blood varies from 6 to 8 ounces. Duration. Varies between 24 and 42 days between cycles. Hypothalamus releases chemicals that stimulate pituitary. Pituitary produces follicle-stimulating hormone and luteinizing hormones. Negative feedback mechanism. This mechanism provides an internal control that regulates hormones fluctuation during the 3 phases of the menstrual cycle. Menstrual cycle continued. There are 3 phases of the menstrual cycle. These include menstrual, or the shedding of the endometrium, proliferative, thickening of the endometrium, follicle maturation and ovulation, secretory, the corpus luteum development and further thickening of the endometrium. Sexual activity in the menstrual cycle. In general, there is an increased desire and interest for sexual activity during the proliferative part of the menstrual cycle. During other parts of the cycle, such as the menstrual part, there tends to be avoidance of sexual activity. Menstrual cycle problems. These include premenstrual syndrome, physical discomfort and emotional irritability prior to menstruation, dysmenorrhea, painful menses, and amenorrhea, no menses. Self-help for menstrual symptoms. These include such things as diet and exercise. TSS, or toxic shock syndrome, is most common in menstruating women. A couple of things that you should consider as we go through this section are: what are the symptoms of premenstrual syndrome and dysmenorrhea? Another question to consider is, what can a woman do to minimize these symptoms? Menopause, a couple of terms that we should know. Climacteric, the physiological changes during transition period of fertility to infertility. Perimenopause, the time before menopause. And menopause, cessation of menstruation, or the end of the menstruation cycles. Hormone therapy is a common treatment during menopause. This includes the use of supplemental hormones during and after menopause, or following the removal of the ovaries. Some hormone treatments include estrogen, progesterone, and/or testosterone. Hormone therapy. Bioidentical hormones. Safety in regards to breast cancer and health disease should be taken into consideration with a physician's advisement. There are risks and concerns with hormone treatments in these issues. Controversy in hormone therapy research. Deciding to use hormone therapy is a very complicated and intricate decision with many parts to be considered. There is also much research that is contradictory and confusing related to concerns in hormone therapy. In short, the decision to use hormone therapy is a challenging decision, and the participant must weigh potential benefits against the risks of hormone therapy. Gynecological health concerns. These range from minor infections to cancer. Some of these concerns include urinary tract infections, or UTIs, which are bacterial in nature, and vaginal infections, which are generally referred to as vaginitis. Pap smears are recommended for sexually active women on an annual basis, and Pap smears are used for screening for cervical cancer. Surgical removal of the uterus and ovaries are sometimes called for. The removal of the uterus is referred to as a hysterectomy, and the removal of the ovaries is referred to as an oophorectomy. The breasts. Secondary sex characteristics. Secondary sex characteristics are physical characteristics other than genitals that distinguish males from females. Included in the breasts are mammary glands, which produce milk after childbirth, areola, which are the darker areas of the breast, and the nipple, located in the center of the areola and has openings for milk. In figure 3.8 below, you see a cross-section of front and side views of a female breast. The breasts continued. Important consideration. Breast self-examination. Part of healthy living for women includes breast self-examinations on a regular basis. Most doctors recommend self-examinations at least once a month. During the self-examination, women are looking for changes in the breast tissue, including changes in texture, changes in shape, dimpling, and unusual discharge. Breast cancer screening. Mammograms are a commonly used screening method by doctors. Doctors may also recommend other screening mechanisms for breast cancer. Breast lumps. Not all lumps in breast tissue are cancerous. Some lumps are cysts or fluid-filled sacs. Others are fibroadenomas, which are solid, round, benign tumors. And finally, there are also malignant or cancerous tumors. If a woman is diagnosed with breast cancer, there are several things to consider with a medical professional. Some of these things include types of treatments, which can vary dependent upon many factors, risk factors for each woman for the various treatments or the types of cancer and stages of cancer they have. The option may exist for reconstructive breast surgery. Early detection of breast cancer is important in treatment and successful resolution. And back to treatment options that doctors can recommend. Summary. Female genital structures include both external and internal underlying structures and organs. Female bodily processes include menstruation and menopause. Gynecological and breast health are two important issues that can affect a woman's sexuality.